The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about Medicare, and we're especially going to be talking about Medicare if you decide you want to keep another insurance like an employer retiree insurance along with it. There's some ins and outs with that you need to be aware of before you make decisions, so we have a great show planned with an actual almost beneficiary. Today, stay with us.
Are you looking for a helping hand through the maze of human services, or for information on government programs and benefits that you may qualify for? The Information and Assistance Program provides information on all programs that meet our aging population's basic needs and programs that enhance their lives as well as the lives of their families or caregivers. If you have questions about Medicaid, Medicare, or other services and programs, please call 1-800-551-3191.
Sometimes the difference between having the life-saving medications you need and going without is the premium on your Medicare drug insurance. If you're a Montana resident enrolled in the Medicare prescription drug program, you may be eligible to receive help with your premiums, even if you own your home or other assets or think you may have too much income. Call or visit the Big Sky RX website today to find out if you qualify.
There you go, ma'am. See you next month.
Thank you.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today we're going to try something a little different. I'm going to put my Medicare hat back on as well as my interviewer hat. We have with us a gentleman who is 63 now and has lots of questions about his Medicare and how it's going to coordinate with his employer retiree coverage. We thought that was a great idea for a show because lots of you out in the audience are facing the same decisions. With us is Steve Blazina. Welcome, Steve.
Thank you.
And Steve,
Kim.
You are a program officer with the Senior and Long-Term Care Division.
Yes.
And as we always say, we're the first ones that should know this stuff, right? But we still have questions.
Yes,
Correct?
that's true, and that's why I'm here. I definitely have questions today.
Great. So what would you say, because as I told the audience, you're 63 now, your Medicare comes when you're 65, and you want a plan before you get to that point because you're not ready to retire just yet. Would that be correct?
Yes, this is correct.
Okay. So what would be your biggest question?
Well, to start with, like I said, I want to retire in a couple of years, and I want to start planning especially for, retirement health care. I know I will get Medicare at 65, but I also want to keep my employee insurance coverage. So at this point, where do I start?
Okay. Very, very good question because there's so many more beneficiaries in that boat anymore. With that big baby boomer lump that came through, we have a lot more people wanting to do such a thing. The very first thing you're going to do is contact the benefits department where you work and tell them just what you told me. I want to retire at this certain time. I want to keep my employer coverage. How does it change? What will it cost? When do I need to apply, or does it just change over automatically? one of the things that people need to know is that, first of all, once you go from your retiree or your coverage as a working person, your retiree coverage is different. It is more of a supplement or a secondary to Medicare. And so what happens is when you turn 65, if you're not working, you have retiree insurance. Medicare becomes primary, so they pay first. And then your other insurance, that retiree insurance, will come in and pay what's left over, most of it, so you don't have much out of pocket. But if you are still working, that retiree insurance becomes active employee insurance, and even if you have Medicare at that point, your active employer coverage is what's going to be covering you primary. And one of the things that I always tell people is check with benefits, because there's a cost to some of this stuff, and there are always deadlines. There are always you need to sign up by such and such, and you need to do this and that. So you want to find out exactly what it is that they want you to do, because many times every company is different.
Yeah, because one thing I'm wondering about, in the 2 years when I'm looking at retirement, I'd be eligible for Medicare in March of that year.
Okay.
And I plan on to retire at the end of the calendar year. So do I need to sign up for Medicare on my birthday, or by the time, I reach my retirement at the end of December?
Well, a couple of things with that. That's another thing that you want to talk to your benefits department about, because lots of times, not always, it depends on how big the company is, Medicare can shift the primary-secondary relationship with coverage. But so you want to make sure that the benefits folks know that even though you have reached Medicare age, that you intend to continue to work for another 6 months, that you want to continue your health coverage as it is at that point. And then what you say to them is, do I need to get Part B? Because I know my A is coming to me automatically, and you might not have known that, but your Part A, or the hospitalization, that's going to come to you automatically. But the Part B, as a working employee, you're already covered for what Part B is going to cover you for. And so you want to make sure you talk to benefits about that and let them know how you're planning it, because they can tell you if there's any change in who pays first or that sort of thing, and also give you an idea of what will happen when that changes over to the retiree insurance. You can sign up on your birthday for your Part B, but you would probably want to opt out until you actually are done working. And again, that's another thing you talk to your benefits people about. If their insurance is considered creditable or just as good as or better than Medicare Part B, you can opt out until you actually have to go out.
Then I could, like I said, in December I could go back and then apply for Medicare Part B.
Exactly. Well, actually,
or how's that work?
You want to do it closer to your birthday, I think, and let the folks at Social Security, which is where you sign up, know that this is your plan. You want to switch right over on January 1st into Medicare and your retiree insurance. And working closely with the benefits folks, it's going to make that a smoother transition for you. Now, we have a lot more to talk about with this, because it can be a little complex, and we just need to ask some more questions, and I need to give you a little bit more information. So, folks, don't go anywhere. I know this is a situation that a lot of you are finding yourself in. You're going to have Medicare, and you're going to have retiree insurance. So we want you to know how to coordinate that well and without spending too much money and not getting a penalty because you didn't do something you needed to do. Stay with us. We will be right back.
I don't think a nursing home is a place for anyone when they have a choice. of staying in their own home. If you can find people that are willing to help you, you might still be able to stay at home. I wouldn't be where I'm at if it wasn't for people like Johnny. That's what home care is all about, is having people that are willing to help me. It's just people helping people.
Cover your mouth or your ears. Now use the telephone. For people who are deaf, hard of hearing, deaf-blind, or speech-disabled, your state's Relay makes it possible. Anyone who uses a standard phone can talk with this important consumer population. With Relay, it's possible.
It's possible. It's possible for you to talk to me, for me to talk to you.
It's possible! Dial 711 to use your state's Relay.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Hi folks, welcome back to Aging Horizons. We're here with Steve Blazina, a soon-to-be Medicare beneficiary, and we're talking about just the whole procedure and what you need to do and who you need to call when you need to do it. Hi Steve, welcome back.
Well, thank you. You know, we discussed a few things earlier, but I'd like to get some clarification.
Okay.
You know, to make sure I'm clear on things.
Okay.
You know, I want to keep my employer retiree coverage along with my Medicare. Now, can I do that?
You absolutely can. And you also mentioned that even though you are going to retire December 31st, you actually turn Medicare age in March of that same year. All right, so you're gonna go to ahead of your birthday, because the enrollment time for a person coming into Medicare at 65, at 65, is you get 3 months before your birthday, your birthday month, and then 3 months after. That's your enrollment period. So you get 7 months. I always tell people, do it before your birthday month, because then that means that on the first day of your birthday month, you are set in place. Your Medicare is ready to go. If you wait till after, those 3 months after, the startup time can be staggered. You might have to wait a month or two to get the actual insurance in place. So first of all, be thinking to do this, or put it on your calendar to do this prior to your birthday month. Call benefits. Say, I'm about to turn 65. I'm going to sign up for Medicare prior to my 65th birthday. I know that I get A because all beneficiaries get A, premium free, and that's the catastrophic coverage. But do I need to take Part B? Now, Part B, Steve, is your outpatient coverage, and that's exactly what your employer coverage is all about for the most part. That's what you probably use it for the most, is outpatient services. What the people at the benefits are going to say to you probably is, oh yeah, you can opt out of Part B until you actually go on to Medicare, after you retire, so January 1st of the next year, because you're retiring on 12/31. Our insurance is good as or better than that Part B. We have you covered for now, so tell Social Security, we're going to cover you for that 6 or 8 months, whatever the time frame is, until December 31st. Then on the 1st of January, you switch over into the retirement mode because you're no longer an active employee. At that point, Medicare becomes primary. You still have that retiree insurance from your employer, but remember we talked about it's structured differently. It's not it's not as robust as a plan you might get as a current employee, because Medicare is picking up the first of it, and it's designed to do it that way. So yes, absolutely, you can do that.
Can I ask a quick question too? In signing up for Medicare, can I have the option to go into the Social Security office to sign up, or can I do it online?
You can do it online, and it's quite easy, actually. I haven't done it all the way through, but it's pretty easy. You can call your local office, Social Security office. It can get difficult to get into them. They're like everybody else these days. They have many, many less employees and many more cases that they're working on, and so it might be more quicker for you anyway to go online first, see if you can do it. If you can't, that's okay. Give a call to the Social Security office and say, I need to sign up and I just need a little assistance, and they'll be happy to do it. You can also call SHIP Counselor.
Oh, that's
at the
excellent.
Area Agency on Aging.
Well, that's good information to know. I'm very happy about that. The other thing, I'd like to know about is what's the difference between a Medicare supplemental insurance and Medicare Advantage?
Big differences. We have a sort of, let's start, we're going to walk back just a step and say there's traditional Medicare, and what that means is you get Parts A and B, and you can go to any doctor, any service covered by Medicare that is a Medicare provider. So that you can sort of just do whatever you want. You can go to the doctor you have gone to for years, but that's the traditional. Medicare Advantage is they're networks. It's sort of you get your Medicare through a private organization like Humana or Blue Cross Blue Shield. Those are just a couple of them. There are many, many more. And they try to be what they consider a one-stop shop. So they're giving you all of the equivalent services to your traditional Medicare, but they're also giving you maybe a little extra. Maybe they're giving you some vision care, some dental care, something extra. But they're designed to be wraparound so that you have less out of pocket than maybe in the traditional sense. Okay. Then over here we have the supplemental insurances. They only work with traditional Medicare because traditional Medicare is an 80-20 split, and that means you have 20% left over to pay as the beneficiary. A lot of people want to have a secondary insurance or a supplemental to help pick up that extra percentage that is out of pocket. So those work together, traditional and supplementals, and a Medicare Advantage is really trying to be both of those things in one company as much as possible. That's not exactly it, but as close as I guess I can get to explaining it well. And they're very different animals. And when we come back, I want to tell you what you're looking for if you ever do decide that you want a Medicare Advantage plan or a supplemental. Folks, again, I bet you have these questions as well. Please don't go anywhere. We have a lot more to talk about, and we want you to get all the information that we're getting to Steve, so stay tuned.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmer's market.
Now the big guy comes after that, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
All across Montana, people are making a difference. Well, my Arthritis Foundation exercise program is a lifesaver to all the participants that are in it.
I bent down to pick up a piece of trash, and when I stood up, I started walking backwards down the steps. I managed to stay up because of a lot of the exercise we do helps with the balance. My lifesaver.
For more information, visit dphhs.mt.gov/arthritis.
I had a pain in my back.
I just didn't feel right.
I was short of breath.
A pain in my jaw.
I didn't have any pain.
Just pressure in my chest.
I didn't know it.
I was having a heart attack.
A heart attack.
I could have died.
Know these warning signs and call 911 immediately. Most heart attacks start slowly and are not always intense with the typical chest pain. New medications and treatments can prevent disability and save your life.
Hello everyone, welcome back. Today on Aging Horizons, we're here with Steve Blazina, and we're talking about coming up on your retirement. You want to be planning for things. We've talked about that so many times on this show, and so when we had a chance to interview someone who really wanted help with that in his real life situation, boy, we were happy to have him. So Steve, again, welcome back.
Thank you.
Now, we were talking about the difference between Medicare Advantage and Medicare Supplements when we left our last segment. Was there anything that I was not clear enough about with that for you? Do you have any other questions on that?
Not at this time.
Okay.
I mean, that sounds, I understood that.
Okay, good. Now, there is, before we leave that point though, I want to mention something that I think is very important for everybody in their planning, and that is, look around. Don't just, I know that you feel that your retiree insurance is going to be pretty good for you, will work well, but just for sake of good informed consent, go ahead, due diligence, whatever we call it, go ahead and look around a little bit. Talk to a SHIP counselor prior to signing up for whatever you sign up for, and let them know kind of what you have in mind, and they can help you look at some other options, just in case. Now, we do want to stress the fact that if a person retires and they drop their retiree insurance, it is almost impossible for them to be reinstated in that. It just doesn't usually go that way. So we don't want people to make rash decisions at all. We want to make sure that prior to signing up for something that they've looked at lots of options, because you just never know. What if you get into that retiree insurance and all of a sudden something changes that you think, oh, that I should have gone that other way. You could do that, but if you drop that insurance, again, you won't probably get it back. So that due diligence to begin with, very, very important. We'll put the SHIP number up on the screen, because that's the kind of thing, even if you give them a call, you may not have to have an appointment. They just may say, here's some resources for you. Take a look. If you have questions, call me back and we'll go through it again. And then, you can just kind of, in your spare time, take a look at the internet.
Okay, that sounds excellent.
Mm-hmm.
I do have another question.
Sure.
I understand there's a Medicare Part D.
There is.
And could you explain if I need that or not?
Sure.
Or?
Well, Medicare Part D is the drug coverage piece of Medicare, and in cases of traditional Medicare where you have A and B, you might have a supplemental insurance, you're going to need to buy a Part D, and we call them standalones, and many companies have them. They're just the RX coverage. In order to have all parts of Medicare, to not be penalized later for not having all parts, and also for, excuse me, covering in the best way your prescription medication needs. Now, under a Medicare Advantage plan, they often include meds with their plan. So you buy one plan through the Advantage, and they have the A, the B services, and then they also have a piece for your prescription drugs. So you don't have to buy an extra. With a person that is keeping their retiree insurance, once again, they need to talk to HR or their benefits, their benefits people, to make sure that there's going to be a drug benefit in that retiree insurance. Now, I know about yours, some about it, so I know right now that there is a drug coverage in it, so you wouldn't have to buy anything. The drug coverage is as good as or better than any Part D plan, so you can stay with it, and you don't have to, you won't have to go out and buy one. And if you ever did need to buy one, as long as you enrolled within the proper time frames, you wouldn't be penalized because you had good coverage in place until maybe you gave it up and you decided to just go with the Part D plan. And again, I want to stress, those are the kinds of decisions that you really want to talk over with someone, like a SHIP counselor. We always say talk to your family, talk to your friends, talk to people you trust, but also try to talk to an expert and find out exactly what they can tell you about the different options. There's so many. So I guess in a nutshell, the answer to that question is you have to check with your HR or your benefits people, and they'll tell you. Part D every year is going to have an annual election period from October 7th to October 15th to December 7th. You'll hear about it. You'll see it. You already have, excuse me, I bet, seen it on TV commercials and things during that time frame. As a person who's going to retire or be on Medicare soon, you're going to start getting mailers about them, different companies, and there are ways to take a look at those, to look at them side by side to see what's going to work the best for you. A SHIP counselor can help you with that. If you don't want to meet with them, they can give you instructions on what to do and where to look, and they can help you with that. So I guess I just want to really say, to clarify, that you just need to check first with the folks that have your retiree insurance. They will tell you if there's a drug component. If there isn't, you need to get one. Even the folks that we run into that don't take medication, we advise them to find something low cost, because then they don't face a penalty later for not having that piece of Medicare, which is important to the folks that run Medicare. This has been a great time, Steve. I hope I answered all your questions.
Could I ask one quick one?
You sure can.
Once you're on Medicare, does Medicare send you like a booklet to describe what's covered in Part A, Part B?
Every fall you're going to get it, and if you don't, you can go online. They have a great website, Medicare.gov, and we talk about it here often. And folks, I think we're going to have to do this again. We have more questions, so we'll see you next time on Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.